Okay, so good afternoon, friends. We welcome you all again on behalf of Gahlaut Healthcare and RENU IVF. Again, we have taken up a very interesting topic and very important topic in our routine practice, which is often missed by we surgeons, and we directly jump onto the surgeries and we miss these basic tips and tricks. So, Dr. Shefali, she is my ICOG fellow. She is indeed a prodigy, a very hardworking, humble, and nice person, and very fast. She learned her laparoscopic skills, and she's able to do her laparoscopy and hysteroscopy very nicely. Very committed girl, and a nice academician indeed. So, welcome, Shefali.
Good afternoon.
So today's topic, you can start, and in the end we can take up a nice discussion and questions. In the meantime, if any one of you is having any query or the question, it will be nice if we can just put up the questions in the chat box. We can start sharing this.
And may I start? Good afternoon, one and all. Myself, Dr. Shefali Shah. First of all, I would like to thank Dr. Renu Singh Gahlaut, ma'am, for giving me this opportunity for being the part of this curriculum. Today, I will be here to present one of the most important topics, that is sterilization of laparoscopic.
Yes, Shefali, just a second. Beta, keep your mic थोड़ा सा पास में रखो. तुम्हारी आवाज थोड़ी सी ब्रेक कर रही है. थोड़ा सा पास रखो, देखो. Or increase the volume, whatever.
Today I am here to present one of the most important topic of our surgical field, that is sterilization of laparoscopic instruments. In this topic, I will tell you about the ways of sterilization, how to sterilize the instrument proper manner, and how then up to what time you can use them. First of all, I will start with the definition. What is sterilization? That destroy and eliminate all form of microbial life. That is, it's
sorry to disturb you, beta, but अब तुम hands free हटा के देखो.
Okay.
देखो बेटा, hands free हटा के देखो. तुम्हारी आवाज बहुत कम आ रही है. थोड़ा सा पास से जोर से बोलो. हाँ.
देखती हूँ मैम. Now coming to the definition, that is sterilization. What is this? That process that destroy or eliminate all form of microbial life.
No, Shefali बेटा, तुम्हारी आवाज कम आ रही है. क्या किया जाए? Can you do something for this? You can fix it up.
Okay, ma'am. मैम एक बार दूसरा एयरफोन लगा के ट्राई करती हूँ. अभी भी मैम क्लियर नहीं हो रहा है?
मतलब इतनी अच्छी नहीं आ रही जितनी आनी चाहिए ना.
ओके मैम.
से है क्या प्रॉब्लम? Is everyone able to hear her properly? कि I am listening little low.
Ma'am, here it is clear.
It is clear? Okay, fine. Please go ahead. Sorry, I'm extremely sorry. Go ahead, Shefali.
Okay, ma'am. Thank you, ma'am. Now coming to the definition, I would like to define for sterilization. What is sterilization? That destroy or eliminate all form of microbial life. Now coming to the definition of disinfection, it is the process that eliminates many and all pathogenic microorganisms except few bacterial spores. Now, Spalding classification of medical devices, it divided the medical devices into three categories: critical, semi-critical, and non-critical. So what is critical one? The object which enter into the sterile tissue or vascular system, like our laparoscopic instrument, all that we uses. Semi-critical one, that touches the mucosal membrane or the skin, which is not intact, require disinfection process, that is high level of disinfection that require. And non-critical one, that object only touches the intact skin, like our stethoscope. Now the critical equipment requires sterilization, that I said earlier. Now CDC guidelines, what it says? It says sterilization is preferred, but high level of disinfection is done for hepatitis B virus, HCV, HIV, tuberculosis, contaminated diseases. Membership survey says that 10,000 laparoscopic gynecological procedures, if sterilization is done by the high level of disinfection, it reduces the rate of infection by 0.3%. Now coming to the definition of different ways of disinfection method, that is low level of disinfection, which act only on vegetative forms of microorganism, intermediate, which act on vegetative and tubercular bacilli, high level of disinfection, which act on vegetative, tubercular bacilli and spore, but not all kind of spores, and sterilization, which act on all kind of spores and all microorganisms. Now coming to the sterilization cycle. What is sterilization cycle? It consists of surgery followed by soaking the instrument in intraop and then washing, followed by sterilization, then storage and transport. So what is the essential step to perform in correct order? First of all, dismantle the instrument, then decontamination, followed by pre-cleaning, cleaning and rinsing, drying, sterilization and storage. So washing is one of the most important steps to be done itself on the OT table. As the surgeon is doing cautery or something else, cutting, the charred tissues come in contact with that. We itself on the OT table, we kept a water ball ready and wiped the instrument well. What does it needed? It needed good quality of water, detergent and enzyme preparation. Brush and flush. It is basically use our complex design laparoscopic instrument which having articulating grooves and forceps with narrow lumen sheath in which blood and mucus were entering. Now here is the video showing how the dismantling of the instrument was done. Here are laparoscopic instrument. One by one, the person is remove each of the parts. Here it removing the handle, then outer sheath followed by internal sheath. Then while dismantling all this, he first of all used a gauze piece wet with the sterile water. Then he wiped each and every instrument with proper manner. One by one, he is doing the same on each and every part which we dismantle. Then what he is doing right now is flushing. That is the lumen under which the blood or the mucus were present. That is flushed out by giving just a jet of water. You have to done this procedure after every surgery. It is one of the most important steps to be followed. Then after all this is the brushes which is used for cleaning the internal channels of the lumen of laparoscopy. And this one is the nylon brush, which is simply used for the cleaning of the articulation grooves of the bipolar and other Maryland or Caesars. Now, what is the cleaning pathway? It consists of on table, which I showed you in the video, that on table he is wiping and keep the water ball ready. Running water is the best one, which decreases all the organic load. Then dismantle and clean the channel. Dip in the detergent and enzyme solution. Clean the channel, joint and serration. Brush it well or the water jet, followed by you kept the instrument in ultrasound cleaner. Actually, what it does, it simply vibrated and all the particle which is not removed by brushing and flushing, it removed by ultrasound cleaner. Then you dry the instrument, then you kept in the Sidex box, or you have to do autoclave, whatever the way you are doing in your setups. Now, substances which is harmful for our instrument, that is bleaching powder, iodine based preparation, abrasive cleaner, vim powder, the laundry detergent, surgeon's hand scrub and soap. Disinfection, which I said, it kills only pathogenic microorganisms. It is not active on the spores. So it is also divided into three categories: low level of disinfection, intermediate level of disinfection, high level of disinfection. So low level of disinfection, it reduces overall numbers of vegetative microorganisms. It's not act on tubercular bacilli. It usually used in our OT table and floors. Intermediate level of disinfection, which act on vegetative microorganisms, also on tubercular bacilli, viruses, fungi, and few spores, not all. This is used in our OT where the breach of skin or mucosa is not there. And high level of disinfection, which act on all three of them. It is applicable for our laparoscopic instrument or delicated instrument which we are using in our surgical procedures. Now, various methods of disinfection I will talking about from low to high level. First of all, low temperature steam. This is one of the basic steps to be done even if you are autoclaving the instrument. That is, under 73 degrees Celsius for 20 minutes, you kept the instrument. Or either you use boiling water 100 degrees Celsius for 5 minutes. Then coming to the various chemicals, that is formaldehyde, which is airtight chamber at 50 degrees Celsius. Time it's not mentioned anywhere. That's why our formalin chamber is called ban of the laparoscopy. And glutaraldehyde, which is Sidex, one of the most important and used in our OT setup. It provided high level of disinfection. It kills all the viruses, bacteria, and tuberculosis. And orthopathaldehyde, in which soaking time required only 12 minutes at room temperature. Now coming to the chemical disinfectant, I will talk about the glutaraldehyde. It is simply called Sidex. Destroy microorganism by alkalization of amino acid. Efficient bactericidal, fungicidal, and virucidal activity. Once activated, it is only for 14-day half-life. After that, you cannot use it. It has to be prepared by mixing it in solution. Contact time for high level of disinfection is 20 to 90 minutes and sterilization is 6 to 10 hours. Sidex Plus, it is 2.5% glutaraldehyde. It provides disinfection by 25 degrees Celsius in 20 minutes. And then Sidex OPA, that is orthopathaldehyde. It is compatible with wide range of medical devices. No active mixing or activation is required. It even acts on tubercular bacilli at 12 minutes at 20 degrees Celsius. So what kind of are heat sensitive and disposable materials to be used for this process, like corrugated drains, suction tube, catheter, and laparoscope. Now hydrogen peroxide, it is one of the other chemical disinfectant. That is, it also having bactericidal, virucidal, and sporicidal, fungicidal activities. How it acts? The hydroxy free radical, which act on lipid membrane of the cell of the microorganism, and that's its way how it kills the microorganism. In viruses, it requires 1 minute time, while mycobacteria and fungi 5 minute time is required. Paracef, what is it? It is 0.8% paracetic acid with 1% H2O2, that is hydrogen peroxide. How it acts? It simply denatured the protein and destroy the cell membrane. Its advantage that it is effective on the mycobacterial resistance organism. Soak time is only 10 minutes. Now, factor which is affecting the efficacy of disinfection and sterilization is number and location of microorganisms, innate resistance of microorganisms, concentration and potency of disinfectant, physical and chemical factor of disinfectant, and then organic and inorganic matter, prior cleaning, moisture, and duration of exposure. Safe use of chemical disinfectant, what does it need? It needed, first of all, you have to check what you are using. It is either efficacious before use or not. Use sterilized stainless steel tray for the Sidex. Avoid plastic tray. Never use plastic tray for Sidex solution. And then thoroughly clean and dry the instrument before putting in the Sidex. Even because if water is on the instrument, it changes the pH of the Sidex, which leads to failure of disinfection or sterilization. Use always gloved hand to pick the instrument. Lifter should not touch the tray wall. And rinse the instrument with sterile water at least 3 times. Sterilize the sterile water tray and dry the all instrument before use. Now coming to the other method of sterilization, that is steam sterilization with autoclave, which everybody commonly knows this process. It is what this porous loaded vacuum autoclave, under which the small pores were present, which help in autoclaving the instrument. The instrument is not kept as a bare. The instrument, first of all, we wrap the instrument in the sheet, then followed by we kept the instrument in the autoclave. Time, it requires 15 minutes for 121 degrees Celsius and 5 minutes for 134 degrees Celsius. It is useful for our mechanical instrument and telescope. Moist heat autoclave, under which moist heat under pressure it is used, routinely 121 degrees Celsius for 15 to 30 minutes. Another one is flashed autoclave, which is act on 132 degrees Celsius for 4 minute porous and non-porous materials. Quick penetration in the material, unaffected by the presence of any organic matter. It is useful for linen, metallic instrument, glasses, fluid, and plastics. ETO, as you know, in our OT setup, ETO is commonly used because it is one of the best way to sterilize the instrument, although it is costly. How it acts? It acts by alkylating the N position of guanine in DNA directly. So the temperature and duration it required is 54 degrees Celsius for 150 minutes and 7 degrees for 5 hours. Aeration cabinet is 24 hours. That is the how much time after the ETO the instrument is kept for the aeration, that is 8 to 24 hours. Then after that we can use the instrument for our OT setup. It is used for heat sensitive items. How to monitor? By indicator strips, which I showed you, which are mostly Bowie's tape and other use. Disadvantage at risk of inhalation injury is most common and it is costly. Standard ETO cycle consists of 285 minutes with aeration time of 8 to 24 hours. Monitoring is done with Bacillus subtilis spores. This one is ETO and this one is the wrapper. How we kept the instrument? First of all, we wrap in the ETO polythene bag. Then the method of sterilization followed. Newer method of sterilization is gas plasma sterilization, which is commonly called as STIRAD. It is uses hydrogen peroxide 150 degrees Celsius for 30 minutes. All heat sensitive items we use in simple way. It is having small tray and special packing is done for the instrument and we kept the instrument in that. And another one is Sterilization system, which uses paracetic acid 500 degrees Celsius for 30 minutes. It is also for heat sensitive and point use system, that you can use it and then after that you can take it on use of your process. Now gas plasma sterilization, its advantage that it is not toxic, no toxic byproduct. Cycle time is only 55 to 75 minutes. No aeration period is required. That is instrument immediately used and approved for the use of stainless steel devices having lumen more than 3 mm diameter and length 40 cm. Metallic and plastic instrument with lumen of 6 mm and length less than 31 cm. Disadvantage that it's not for layman. Cycle turn off if the moisture is present and expensive for both equipment and running. How to monitor the process of sterilization? By using two methods. Bowie's Davis tape, in which the tape is used, which changes the color. It shows whether the sterilization is effective or not. And biological indicator that which we are using is Bacillus stereothermophilus spore, which is used in steam autoclave, and Bacillus subtilis spore, which is for dry heat sterilizer. Now, indication of sterilization. We sterilize the instrument, and what way we know how much instrument is sterilized or not? Is it ready for use or not? It is by using the indicator system, which I said you earlier, and the physical and chemical changes observed. Whether we release the instrument or not. For laparoscopic endoscopy, what we use, simply you use warm water, pH neutral solution and rinse it thoroughly. Ultrasonic cleaner is not used, and for cleaning it is not mixed with other instrument. You clean it for separately. And chemical disinfection, which we are using it, is Sidex solution, glutaraldehyde enhanced parasitic acid or orthopathaldehyde. Sterilization time is only 32 hours. Sterilization of endoscope by three methods: gas sterilization, autoclaving, and new method. Gas sterilization, warm and cold. Cold having 4 hours for 30 minutes at 85 degrees Celsius with aeration of 12 hours. Warm 2 hours 30 minutes for 145 degrees Celsius having aeration 8 hours. It is costly and longer duration. That's why not used. It is used in very high setup where it is required. It requires a lot of money and all that. And autoclave, it is commonly used with 121 degrees Celsius for 15 minutes. It is cheap, but not for all endoscope. And newer method, as I said earlier, STIRAD, under which hydrogen peroxide vapor with low temperature gas plasma, 75 minutes with minimal space. That is one of the drawbacks, that is minimal space, and it is very costly. Sterilization of cable. Now, how to sterilize the cable of the monopolar, bipole? These all are heat and moisture sensitive item. What is the preferred method is ETO. Any standard cycle, which I said, any standard cycle you use ETO for that, and STIRAD having short turnaround time, but it is costly, therefore not amongst the in the present era. Less preferred is chemical sterilization, and not preferred is steam autoclaving. Heat tolerant endoscope and accessory sterilization is first choice. For heat sensitive endoscope and accessory, ETO, gas plasma, and low temperature steam plus formaldehyde, and insufficient time to sterilize the instrument. That is, अगर time आपके पास कम है तो then how will you sterilize the instrument for next surgery? Simply immerse in Sidex solution at least for 25 minutes. And if a microbacterial infection is suspected, then more than 25 minutes time is required. That is high level of disinfection, and 4 are required for killing the spores. Now, national survey says what the method we're using in our India, that is formalin chamber, most commonly used. Our surgeon basically use formalin chamber for sterilization, but it is not effective as I shown you in the next slide. I was talking about that. Then followed by Sidex, then autoclave, and fourth one is gas plasma sterilization. How to reuse the disposable instruments, whether it is used or not. Issue for this, and again reuse, many studies were done. I will be looking forward that it affect on procedural outcome or not. I will be talking, and can be disposable, it ever clean or sterilized adequately. Literature says that reusing the disposable laparoscopic instrument did not change the operative and post-operative outcome or infection rate. None of the patient had infection at wound site or intra-abdominally. And disposable laparoscopic instrument having complex design, if we reuse it, the chances of nosocomial infection were high. These are the few studies which is done for reuse of the instruments. Now, formalin chamber. I said this is the ban of laparoscopy. Yeah, it is ban of laparoscopy because it has no standardization. In this, we use a small tablet form. Tablet may be 4, 6, 8, 10, 12 as much. And then minimum exposure time it requires is 24 hours. Now, formalin chamber, I said no standardization because how much is leak, I don't know. Even no one knows, because many times you have to open the chamber, and how many tablets you have to keep, you don't know. Usually, basically, more than 8 tablets were kept. And exposure time, how many minutes, temperature, it is not maintained in that chamber. That's why it is ban of our laparoscopy, but still using. So effectivity of formalin chamber, vegetative form of microorganism, it is effective. Dried soiled instrument, no effect up to 8 tablets, and spore, no effect at all. 10 to 15 formalin are kept in rolled gauze pieces in lowermost part of the chamber, and the tablets you have to change after 7 to 10 days. Now coming to the summary, that soak them well, wash them well. It is the funda for our sterilization of laparoscopy, that on table you soak them as early as you can. You wipe the instrument well so that all charred tissue is removed. It is a critical step to be followed. Then choose the appropriate method of sterilization, one that suits the instrument. And then monitor the sterilization process by tapes and other spore methods. Thank you, ma'am.
That was indeed a wonderful presentation, Shefali. That's wonderful.
Thank you.
And it was an exhaustive one, and you have covered most of the things very beautifully and have come up with the practical things. So now let's discuss few of the things, like you have beautifully pinned out about the formalin chamber, which is most commonly used in India. And another most commonly used thing in India is the Sidex thing. And unfortunately, they are not used properly. And most of the time, this thing can be improved if, first of all, if we can just take note of everything. If the fumigation register is maintained, if a register is being maintained for how the Sidex is being cleaned every 10 days, if the formalin tablets have been put every 10 days, then probably many things can be taken care. Now, definitely formalin chamber and Sidex, and nowadays Parasafe as Parasafe, you know, you have said, which also works on mycobacterium. So more than Sidex, you are supposed to use Parasafe, and only I think the Parasafe should be used when you are doing 2, 3, 4, 5 surgeries in a day, and you don't have time to autoclave and do the ETO. Then only I think Sidex should be used. Otherwise, Sidex should not be used. As you have seen in our OT, I really get angry if I see any instrument being kept in Sidex and reused. So if you have, you're supposed to do, like, your input is of 3 to 5 surgeries a day. So it's better you have 5 sets of instruments, and especially the instruments like trocars, which stay in the contact with the skin of the patient for a longer period of time. So they should be definitely autoclaved. They should not be reused just by putting in the Sidex, because the spores and mycobacterium, they are the worst infection as far as the port site infection is considered. And you have done a wonderful surgery, but if the patient is having an abscess and it's oozing and bleeding, having pain for next 15-20 days or 1 month, then it gives you a very, very bad name. So we should have, like, depending upon what is the, like, you know, the type of load you are having, you should use at least the trocars का उतना set आपके पास होना चाहिए, and the regularly used instrument should be used accordingly. In the OT also, even your cords, your cables, your CO2 things, CO2 cables, CO2 pipe, then your normal saline pipe, and all these things, one should have, I think, in spare. And if you are doing 3 cases a day, you should have 5 at least, so that one falls down, at least you can use some autoclave one. So it's a really bad practice if you keep on carrying your instruments unautoclaved, putting them in the Sidex and then reusing them. Then definitely in 5 cases you might not be having an infection, but 6th case definitely you are going to have an infection due to some spores or some other sort of disinfecting material or mycobacteria. And mycobacteria, they are very dreadful. They are very bad. I have seen 1 or 2 cases of mycobacteria infection, and they are not being diagnosed by anything. It's just by seeing, and just it's like, you know, you just assume it's a sort of mycobacteria. So we have to put the patient on clarithromycin for 10 to 14 days, and that's again a trauma to the patient. You have to extend your treatment. Laparoscopic, we hardly give antibiotics for 5 to 7 days, and then unnecessarily you are supposed to give antibiotics for such a long period of time. So this is a very important message we have to take. And then we have to train our OT staff. This is very, very important. We have to train our OT staff to be very well versed with which instrument to be cleaned how. Because in laparoscopy, the cost of instrument is very, very high. No, it comes in tune. Like in one particular surgery, everyone is using instruments not less than 30 to 50 lakhs. And the recurring cost, even the recurring cost of hand instruments or the cables or the tubings, is definitely very, very high. So first we have to learn so that we can guide our OT staff, and one has to be very, very strict. Then important thing comes about is, like, everyone, I think, should have a pressure gun with themselves, because laparoscopic instruments, they are like tubes, you know, they are tubular long things. So some sort of tissue or the blood or something, it gets accumulated in it. So the very, very important thing is, you have to, like you beautifully said, you have to dismantle the instrument. You have to dismantle after every surgery. You have to dismantle, and then you have to put it in the concerned sterilization. If you are going to do the ETO or you are going to do the autoclave, these are the only 2 things which we have and which we rely upon. So formalin chambers, it can be only for the storage, but you cannot use it for disinfection. Neither you can use it for sterilization. So this is very, very important. And that pressure guns, it helps in removing the inner lining and the inner tube. And then it helps in removing the fluid or the moisture from within the cavities and small joints which our laparoscopic instruments are having. So that pressure gun is actually important. Second very important thing is like ultrasonic cleaner. This is something very, very good. You have to clean and do everything and dry the instrument. Again, very important part is drying of laparoscopic instrument. You need to dry all the instrument, and then you can put in the ultrasonic cleaner, or then you can put them in the autoclave or in the ETO. Again and again, the message is you're not supposed to use the Sidex and Formalin chamber as disinfectant, or this you can have 3 to 5 sets if you're supposed to do 3 to 5 surgeries in a day. Then you have to really thank your OT staff. I will definitely thank my OT staff, Sachin and Ashish, and my OT sister and Shabnam also, because they are really doing good work once the case is over. Even 2 or 3 cases in a day, it gives a lot of work to your OT staff. If they have to, dismantle each and every instrument, they have to clean each and every instrument, then they have to dry, then autoclave or do ETO, and then again mantle them and store them. So it really needs a very dedicated, trained laparoscopic OT assistant and their assistants and their assistants, So at least 3 people are needed in the OT, 1 single OT of 1 surgeon. So this is very, very important. Ultrasonic cleaners, they are really good ones which have come up, and they should be used. ETO, again, I would say it is very, very important, because autoclaving, it does destroy a lot of laparoscopic instruments. So it is very important to go ahead with ultrasonic cleaners and then go for ETO. Now, where we are keeping the corsolex, at least over there we can put a paper so that we can write down at what day the corsolex was changed. Though it should be used only between the 2 instruments. Register should be maintained about the fumigation. It should be maintained when the ETO was done, which instrument was being done, and it should be done in the routine basis. And surgeon must monitor all these things on his or her own. So cleaning kit is again a very, very important thing when we have very dedicated laparoscopy cleaning kits with us. So good quality water, again I would like to suggest, like you said, we should use a good quality water. What do we mean by good quality water? Ideally we should not use tap water, we should use RO water, because normal tap water, if it is having a very high concentration of salt, so again it will lead to demineralization of your instruments, and these salt things will collect and your instruments will wean off very fast. So this is very, very important. You should have a good quality water, means you can use a distilled water, or you can use a simple other than that, distilled water or the autoclave water we can use, like we use for our IVF instruments. So these are the important things. Anyone would like to contribute here? Anything you want to contribute, Shafali, Monisha, or any other participant?
No, ma'am.
Okay. So, thank you.
Thank you.
Thank you, Sachin, you want to?
क्वेश्चन था
हाँ, बताओ.
मैम, हम लेप्रोस्कोपी इंडोस्कोपी इंस्ट्रूमेंट्स में सन स्टरलाइजेशन का रोल प्ले कर सकते हैं क्या? सन स्टरलाइजेशन करके कुछ ऐसा है क्या कि अगर हम इंडोस्कोपी सर्जरी करते हैं, मतलब जो उसके इंडोस्कोपी के इंस्ट्रूमेंट्स होते हैं, हम उसमें सन स्टरलाइजेशन यूज कर सकते हैं क्या?
सन स्टरलाइजेशन, आई वोंट यूज दिस टर्म एज सन स्टरलाइजेशन. का नाम कुछ नहीं हो सकता. इसको सन को, सूरज की रोशनी को तुम सिर्फ इंस्ट्रूमेंट ड्राई करने के लिए यूज कर सकते हो, बट स्टरलाइजेशन करने के लिए अगर ऐसे होता तो हम लोग छत पे सब इंस्ट्रूमेंट सुखा रहे होते ना, फिर ऑटोक्लेव और ETO की क्या जरूरत है? जो अंदर, क्योंकि सूरज की रोशनी को तुम मॉनिटर कैसे करोगे कि उसने कितना टेम्परेचर बनाया? गर्मियों में तुमको हो सकता है बहुत ज्यादा टेम्परेचर मिले, बट उसके अंदर तक जाके तो नहीं वो उसको क्लीन कर पाएगी और पोर्स को स्टरलाइज कर पाएगी. हम इतना हाई टेम्परेचर लेकर जाते हैं जब हम ऑटोक्लेव करते हैं, या ETO में गैस जो है वो इतनी अंदर तक छोटी छोटी जगह पर अंदर घुस के पूरे स्पोर्स और उन सबको क्लीन करती है. करीब 24 घंटे टोटल लग जाते हैं ना. 6 घंटे आपको ETO में अंदर काम करने के लिए लग जाते हैं जब गैस पूरी सर्कुलेट होके कर रही है. फिर आपको उसको हवा में रखना है 8 से 24 घंटे तक, तो आपको इतना लंबा समय लग रहा है. अगर सन से ही करना होता तो फिर चीजें बहुत आसान होती है. अपन टॉपिक ही डिस्कस नहीं कर रहे होते.
अच्छा मैम, जो अपना हैंड इंस्ट्रूमेंट्स हैं लैब के जिनमें आइसोलेशन है, तो उनका स्टरलाइजेशन हम ऑटोक्लेव के थ्रू, या फिर हम आपने जैसे फॉर्मलिन चेम्बर्स को बैन किया है, साइडेक्स को बैन किया है, तो उसका स्टरलाइजेशन हम कैसे कर सकते हैं? फिर ऑटोक्लेव या ETO?
ऑटोक्लेव, आपको ये बात पता होना चाहिए कि आपका ये इंस्ट्रूमेंट ऑटोक्लेवेबल है कि आपका ये इंस्ट्रूमेंट ऑटोक्लेवेबल नहीं है. अगर आप ऑटोक्लेव कर सकते हो, वो बहुत रेडिली यूज्ड है, आप रोज ऑटोक्लेव लगाते हैं, आप अपने इंस्ट्रूमेंट को ऑटोक्लेव कीजिए। उसमें एक स्ट्रिप लगी होती है और हर इंस्ट्रूमेंट पे जब आप किसी भी वेंडर से खरीदते हैं तो उससे पूछिए, और उसपे एक स्ट्रिप भी, एक गोल्डन कलर की वो होती है, आप अपने स्कोप में देखिए, हमारा जो स्कोप है उसपे गोल्डन से कलर की एक वो लगी हुई है, दैट मींस दैट इंस्ट्रूमेंट इज ऑटोक्लेवेबल। सो उनकी अपने इंडिकेटर्स हैं कि अगर इंस्ट्रूमेंट ऑटोक्लेवेबल है तो आप ऑटोक्लेव करिए, अगर आपका इंस्ट्रूमेंट ऑटोक्लेवेबल नहीं है तो बेटर है कि आप उसको ईटीओ करके चलिए।
मैम रोज हमारे जैसे सर्जरी लगी होती है तो ईटीओ करने के लिए इतना टाइम तो नहीं रहता है, या हमारे पास 3 सेट हैं, इसके बाद भी मान लीजिए कि अगर हम एक पेशेंट में 1 सेट भी लगाते हैं, तब भी अगर 3 केस दिन में होते हैं और चौथा या 5वां केस आता है तो फिर हम उसको कैसे ईटीओ करें, क्योंकि हमारे पास इतना टाइम तो नहीं है। ईटीओ में 7 घंटे जैसा कि आपने बताया कम से कम लगता है।
तो अपना 1 सेट और बढ़ा लो।
तो मैम मैं ये कहना चाह रहा था कि जो हमारा स्टरलाइजेशन है वो भी इफेक्टिव है, कि हम जैसे सारे जो भी हमारे एंडोस्कोपिक इंस्ट्रूमेंट होते हैं हम इन्हें जैसे क्लीन वाटर से वॉश करते हैं, और जो एंजाइम क्लीनर्स होते हैं उनको उसमें वेट करके रखते हैं, फिर वॉश करते हैं और फिर ड्राई करते हैं। तो मेरा सन स्टरलाइजेशन सिर्फ इतना ये बोलना था कि हम जब उसको ड्राई करके असेंबल करने से पहले हम उसको ट्रॉली में रख के सन के पास रखते हैं, अगर हमारे ओटी में से विंडो है तो अच्छी खासी धूप आती है तो हम उसको वहां पे सन स्टरलाइजेशन के लिए अगर प्रॉपर 1 घंटे भी रखते हैं तो वो अंदर से स्टरलाइज मतलब थोड़ा बहुत तो उसका इफेक्ट पड़ेगा ही, और इसके बाद फिर हम उसे असेंबल करके फॉर्मिन चेम्बर में रख सकते हैं। जैसे कुछ सेट्स ऐसे होते हैं कि जैसे हम उन्हें ईटीओ कर लें और कुछ सेट्स हम फॉर्मिन चेम्बर में रख दें, ऐसा कर सकते हैं क्या?
नहीं, बिल्कुल नहीं, इस बात को बिल्कुल दिमाग से निकाल दो। सन को 1 घंटे में रखने से कुछ भी नहीं होने वाला है, कुछ भी नहीं होने वाला है, धूप छांव की कोई बात ही नहीं है, ये बिल्कुल नहीं होना है।
फॉर्मलिन चैम्बर वाली बात हो गई है।
हाँ, ये फॉर्मलिन
हो रहा है क्या, ये हमें नहीं पता है।
तो बेटर है कि आप उसी दिन कॉर्सोलेक्स की एक वो खोलो, उसको डाइल्यूट करो, कॉर्सोलेक्स में डाल लो। अगर तुम्हारी हफ्ते तुम कॉर्सोलेक्स में 1 हफ्ते उस कॉर्सोलेक्स को चलो, तुम्हारे पास बहुत केसेस हो गए, कॉर्सोलेक्स को यूज करो, संडे को कॉर्सोलेक्स को तुम बट सन वन का कोई भाई यूज नहीं है कपड़े।
यस मैम, थैंक यू मैम, थैंक यू।
स्टरलाइजेशन नाम की कोई चीज होती तो हम अपने ये लिनेंस क्यों स्टरलाइज करते, कपड़े तो धूप में ही सूखते हैं ना, 6-6 घंटे। ठीक है,
यस मैम, थैंक यू मैम।
Anyone would like to ask any question, anything? And another important thing is OT की cleaning is equally important. It's not just कि instruments को हमको ध्यान देना है, OT के instruments, OT की trolley, OT की wall, floor, roof, पूरा wash करना, पूरा उसको अच्छे से deep cleaning is actually very very important on regular intervals depending upon the load of surgeries which we are having and type of surgeries which we are using. So this is again very very important thing. Everyone must be having the protocol, and that protocol should be strictly followed. It should be recorded and should be signed by the surgeon. This is what I would say, कि we have to owe the responsibility. All those registers should be signed by the surgeon. So I think it was a good discussion. Anything Shefali, Monisha, and anyone else of you, those who are participants, would like to ask? Okay, thank you. I think we are done. Thank you.